you so much for inviting us to come and talk. The work on health and the partnership with Cincinnati Public, I've talked a little bit about it, but not in the setting, has just been, it's what I called a career changer because it's allowed me as a pediatrician to really be able to get to the population level of making a difference in the lives of children, and that there's nothing that serves more the vision of a pediatrician than that. I'd like to introduce first Dr. Camille Jones, and she's the Assistant Health Commissioner for Environmental and Community Health. And they've just done a really intense project, and when I spoke with Madam Chair, she told me that she had been reading this wonderful article about life expectancy, and so we agreed that one of the best ways to begin would be to have Dr. Jones come and talk to you about that. Dr. Jones?
Thank you, and thank you for the opportunity to speak. And I've been told that I have a very small amount of time, so I'm going to try to go quickly. I provided some handouts of slides. I'm not going to go through all these slides, but there are some resources in there, which is why I wanted to make sure that you all had it. Let's see, clicker. Okay, so basically I'm going to be talking a little bit about life expectancy calculations that we made. The health department had previously put out information about mortality rates, and the life expectancy and the mortality rates come from the same data set, basically death certificates where you have information on age, race, sex, cause of death, and the address. The addresses are geocoded into census tracts. The census tracts were re-aggregated into the neighborhoods, the neighborhood approximations that are put out by the city planning department. And then we were able to talk about what's happening neighborhood specific. First, I'm just going to start off, though, just in general in Cincinnati. This was a list of the top 10 causes of death in Cincinnati. These are age-adjusted rates to the U.S. 2000 population. And you see heart disease, cancer, stroke, chronic lower respiratory diseases, diabetes, accidents, Alzheimer's, kidney disease, flu and pneumonia, and assault, i.e. homicide, as the top 10. For the U.S., homicide is not in the top 10. I wanted to show you a little bit, some of the questions that we had was when we present these rates, people look at it and it's like, okay, is 805 high or low? What does it mean? I'm going to talk a little bit more. That's the reason why we did life expectancy. This is just a little bit, just for your information, the homicide rate in youth, 15 to 24 in Cincinnati by neighborhood. And this is just to show you that some neighborhoods had no deaths among youth for homicide, and some have a death rate of up to 70 or 80 per 100,000. Again, what does that mean? Life expectancy is a much more intuitive measurement to measure health in neighborhoods, because if you say to somebody, you're living 5 years less than somebody else, people know what that means, okay? Life expectancy is a calculation, and I have here the information, but I'm not going to bore you by going through the spreadsheet, but basically what you're doing is you're taking the number of people in each age group in a neighborhood, the number of people who died in each age group in that neighborhood, you calculate age-specific death rates, just like what I just showed you for homicide, and then you say, if you took a group of newborns in this neighborhood and followed them throughout their life, and at every stage of their life, they had death rates like what you just calculated for that neighborhood, what would the average lifetime be? So that's what life expectancy is. It's a calculation, and if people would like to talk to me afterwards about this calculation or at any time, you can do it. This is what we found for Cincinnati, that I don't know if this is a pointer, that the overall life expectancy was 76.7 years. That's 2 years lower than the U.S. average, which is 78.7 years. We found differences in life expectancy between males and females of about 6 years difference, where females having a higher life expectancy. Life expectancy difference between blacks and whites of about 8 years, with that difference much more marked among males, a difference of 10 years in life expectancy between black males and white males, 63 versus 73 years. But even these differences, which are astounding and appalling, were dwarfed by the differences in life expectancy by neighborhood. And this is a slide showing South Fairmount, which was the neighborhood that had the lowest calculated life expectancy, 66 years, all the way up to Mount Lookout, Columbia Tusculum, which had an 88-year life expectancy, 20-year difference in life expectancy by neighborhood. And so these are things, when you can see and understand the impact in these terms, then hopefully that's something that can motivate change. When you map the life expectancy, we mapped it on the map of Cincinnati. The more intense color, the darker colors are the neighborhoods that have the lowest life expectancy. And you can see that the map somewhat mirrors the map for concentrated poverty in Cincinnati. I don't have the concentrated poverty map up, but it's sort of similar. So we know certainly that neighborhood poverty is one of the things that can be associated with lower life expectancy. But life expectancy is a calculation, it's not a promise. If one lives in a lower life expectancy neighborhood, that doesn't mean, boom, you're gonna, this is your number, that's it. It's something basically, calculating this is supposed to motivate action, and that's what we're hoping will be happening. What I have here is just a background paper that goes into a lot of detail about a lot of different potential things that could affect disparities in life expectancy. The first ones that they mentioned, of course, education, employment, and income. But there are chapters for each of these different aspects, and certainly if people would like to have that paper, I can send it to you as a PDF file. Don't try to print it, it's about 106 pages. The concept of concentrated poverty is one that people may not be familiar with, but that's where at least 40% of neighborhood residents have income below the poverty line. And people have found that if you are poor and you live in a neighborhood that has the concentration of poverty, your outcomes will be less good than if you had the similar level of poorness in a neighborhood that had more opportunity. And so that's something that maybe the schools can also be thinking about. What can the schools do to help children in these neighborhoods? This is just one of the resources that we have. This is the Cincinnati Health Department website. The maps, the graphs, the actual numbers for life expectancy by neighborhood can be accessed through this web link. We also developed for 19 neighborhoods, neighborhood-specific profiles with information that might be very interesting that people could look at. I'm mentioning that we will be doing a training come August on health impact assessment, and we could talk more about that later if people are interested. And then these are some other resources. One of them, Understanding Neighborhood Effects of Concentrated Poverty from HUD. So these resources are things that you may find interesting as you consider actions in the future. Thank you.
Thank you. I was stunned when I first read this in the Enquirer. Your work is phenomenal and actually has an impact certainly on decisions we have to make for our children and families. It's alarming but incredibly useful to us. And please, there might be some questions at the end of the presentation, or you want to ask now, Mr. Nelm?
Yeah, I wanted to ask, since
Wow.
this is a monumental undertaking and everything you presented is not anything new, at least not to me. What partners are you working with? Because I know the Cincinnati Health Department can't do it alone. What community or outside partners are you engaging to make sure we address this problem of disparity across the board?
We had a roundtable discussion in January 10th that had a large number of people come and participate in discussing what are things that are associated with life expectancy. We certainly are willing to partner with everybody, and we have several folks who have actually come to us, suggesting different types of actions, and certainly more are welcome. I think you're right that it's something that has to be done by everybody. It's not something that we can address by ourselves.
Okay, thank you.
Mrs. Hoffman.
Yeah, thank you for putting this on paper. I think what Mr. Nelms is saying, we probably all knew. Seeing it here is startling. I'm assuming these are very similar in other cities of our size and larger cities, that they experience these same kind of demographic information. Are there cities that are actually moving the needle on this and that are doing things that we can replicate?
Yes, there are several cities that I'm aware of that have produced life expectancy information. One of them is actually Columbus. And in Columbus, They've actually developed health councils, sort of like regional health councils or health districts, where people came together on the basis of having life expectancy information and said, let's prioritize some of the low-lying fruit that we can see in our particular region and see if we can get together to move change. There's some people in California who have actually done things related to blight and, actually got legislation that required banks that had properties that had been foreclosed to actually do something about those properties rather than just letting them sit there and deteriorate. Cuyahoga County has produced life expectancy data. I haven't seen what they have had come out of it printed yet, but they're working in it, and there are several other areas, people who are working on it. I think that really the thing is the motivation of action, because, while you can't do everything, even if you do something, that's going to be helping, the city and the neighborhoods.
Yeah, and I think from the city's point of view, I know the city is doing a number of the things that you're talking about. They're moving on some of those, real estate issues, et cetera. From a board's perspective, are there, from those different counties and states and cities that you just mentioned, are there things that people are doing that we could be thinking about as a board in terms of policy or making our schools more equitable or solving the issues through there? I know, yes, are there things like that that we should be thinking about?
I think that there are, but I'm not personally aware of other boards of education actually being involved. But I think that what you all are doing with the neighborhood, the community learning centers, presents a really good opportunity to be able to be doing something else.
Thank you.
Any other questions or comments? Thank you. Thank you so much.
Thank you so much, and we're going to have our speakers come up. Jim Schwab is the president and CEO of Interact for Health, and one of the major funders of some of the health projects, the primary medical care especially, and he's going to talk with you a little bit about what's been done. Do you want to drive that, or you want me to?
Can you do that? Thank you. Thanks very much. Thanks for giving us an opportunity to bring you an update on the School-Based Health Center Initiative. Before, I want to introduce a couple of my colleagues because they've really done most of the work on these projects. But first, Francie Woolgan, who's back here. Francie is our senior program officer who has been intimately involved on a day-to-day basis in the creation of what are now 20 health centers in the Cincinnati Public Schools, and she has her fingerprints on every single one of those every day, all day. And then my boss, Tom Kleindienst, who's the chairman of the board of Interact, and I'm going to say just a couple words about Interact, but you may know Tom not only from that role, but from his intimate role in the School for Creative and Performing Arts, which you just heard from earlier. And like Tom, I've had some history with the Cincinnati Public Schools because I went to College Hill School, Schwab Junior High School, and Woodward High School. So I'm. This is a labor of love for
the center of the universe.
Yes, it is. A labor of love for both of us. So thanks for the opportunity. This slide, I think the important point here is that this is and when we put these health centers together, there is a financial model that works if we get enough kids and parents and staff and even in some cases folks from the community to participate and use these centers. The billing procedures and practices allow these, once they get up and running, to be financially self-sustaining. But we are at Interact, we're a grant maker, we do policy work, we've now actually moved from a health care approach to a health promotion strategy, focusing on healthy eating, active living, emotional well-being, and healthy choices about substance use. So while we're going to continue our involvement with school-based health centers, we're a funder primarily and an organizer. And what you see on this chart in front of you is all of the other partners. One point along the way, we had 30 different organizations involved in putting these together across our city. And you'll see a reference to oral care in the case of Crest and Oral-B and the Oral Health Foundation and Delta Dental. We're building one in Western Hills, an oral care center. Well, we'll have 4 dental chairs there when we're finished. We have Children's Hospital that you may know just stepped in and overnight took over for the management of 3 of our school-based health centers when neighborhood health care closed. We have 1 site, so we're focusing there on the vision care as well as oral care. So all of those are important. You'll hear more from Marilyn a little later on about how those are all closely integrated to education, success, and achievement, which is really what this is all about. A special call out for the Greater Cincinnati Foundation, the United Way, and Deaconess Health Check, which has been very supportive of the activity over in Western Hills with their funding. So this is a collaborative effort, and of course it's a special thanks to the school board and school system, because the facilities we use after they're built are provided to us free of charge, which we appreciate very much, and is a very important, integral part of the work that we do. So that's I think the important takeaway from this slide. If you move to the next, the goals of the collaborative effort. We've been involved in this effort at Interact since our beginning, which is 1997. We have spent over that period of time about $17 million on the development of these school-based health centers. So not only the centers themselves, but some great longitudinal studies that show the difference, the importance of health on academic achievement. What we do is look for schools in the system where there are enough kids who are Medicaid eligible and enough kids per se. We get consents from the parents and support from the PTO organizations to make sure these can be viable. We have, as I mentioned, we know how these things work from a financial point of view, at least Francie does, so she knows how to put the numbers together, and then we go attract other funders to help in this process. We really got started again on this when we had a crisis at the city funding level, when there was a threatened pullback in funding for the school nurse program, and we were able to use that crisis really to generate a recommitment of effort for this whole program, and in that past 2.5 to 3 years really have doubled the number of school-based health centers. So these are all run by terrific providers, and you'll hear more about them, but the Cincinnati Health Department has a number of those that they do, and they've been a terrific partner, as well as Mercy Health and WinMed and Crossroads. So it's as I say, a real cross-section of the activity and the providers in the community. So just one last map. This shows you the location of the school-based health centers, those that are active, those that are new. We have good discussions underway at Riverview. I can't see it on the map. Should be. And there it is, Riverview East, which is actually in my neighborhood, and at Rothenburg and over in Sailor Park, where we're trying to, and Mount Airy, where we're trying to get new ones off the ground, or they're pretty much ready to get started once the new school year gets underway. So this is we have a great new facility at Woodward High School, which we just dedicated a couple of months ago, and so this is terrific. We're very proud of this, all of us who have worked on it, especially at Interact, and we appreciate your support very much, and look forward to continuing to build these where the opportunity presents itself.